thank you once again, Dr. Ghuman, for your time today. I know you're very busy, but we truly, truly appreciate your presence for today's interview. So before we start, Doctor, can you just please introduce yourself by sharing your full name, your role, your practice, and your location?
So my name is Dr. Param Ghuman. I reside in, Seattle, Washington area. I'm a nephrologist. We are a two-physician private practice, myself and including my partner, Dr. CJ Kwan. We have two offices. One's in Everett, Washington. Second office is in Mount Vernon, Washington.
How long have you been running the practice?
So the original owner is Dr. Kwan. He's been running it for probably 20, 25 plus years. I've been with him since, 2013. So about, 13 or so years.
Wow, you've been really an established doctor there. So we're so blessed to have you here, Dr. Given. So interested to know, prior to working with DocVA or working with our Doc VAs, what challenges or pain points were you experiencing in your practice or in your operations?
So, some of the things, that, our office was struggling with was, there's always an administrative burden. But the problem is, as a private practice to physician practice, all the administrative burden kind of falls on the, physician's, head per se. So, having, Diana or a virtual VA, be a doc VA, kind of, help to reduce some of that, burden. So, what do I mean by that? Obviously, I'm not going to pick up the phone, call patients to schedule or anything, right? So, this is where, she comes in, she's been, quite helpful with, basically, scheduling and being attentive to patient needs. That's kind of, the way me and Dr. Kwan tend to kind of run our practices. We want to get back to patients in a timely manner. Not that, hey, you know what, you call our office, give us, 5 days a week or 3 days or whatever have you. So having, the extra hands where, we're quite busy, where Diana is able to kind of, listen to those patients' needs and, send us messages and we can have just kind of Diana respond to them. So that kind of saves us, a lot of time where we can concentrate on, seeing office patients, hospital rounding and dealing with all the other, administrative stuff behind the scenes that we have to keep the practice running.
So much things that Diana has been able like to offload from your plate. So I'm just so happy to hear this, Doctor. How quickly were you able to get your virtual assistant Diana after the discovery call with us?
It was quick. I don't remember the exact timing, but I think the biggest delay is training. And, the EMRs we use, it's again one of these administrative headaches, right? I can't just add somebody and say, okay, I'll teach you along the way. The EMR company will not give access to any single person without them going through training through them. So there's always that. And you know what? Again, you're right. As a physician, I can't sit there and say I'm hiring somebody. I want them to finish training in a week. So the training also has to happen on the EMR's time frame. So, the biggest delay would have been, I guess you can say on my end with the EMR company. Otherwise, I don't think the hiring process took maybe a week, if I'm not mistaken. So, once you kind of, land on somebody with the interviews, it's a fairly quick process.
I know you have received like a couple of candidates, right? So, what stood out from Diana? What does she have in terms of her credentials, in terms of her experience?
So the biggest thing that stood out from her was the fact that, she's a nurse. It's different to have somebody, run a front end. And again, right, the type of practice that we as nephrologists, we deal with a lot of elderly patients. So, having somebody who's also a nurse rather than saying, hey, you know what, you have this front end person that's kind of just getting back to you. So, having the knowledge and things move fast. So, being a nurse that she's aware of some of the medications and, obviously, right, there's a little deep clinical knowledge. She has some sort of understanding behind the scenes is very helpful rather than, try to teach somebody, some sort of medical basics. And that, again, right, requires time and whatnot. So I'm glad we didn't have to go down the path. So having somebody with a nursing background was extremely helpful.
Thank you for sharing that, Dr. Cuban. So, I know you've mentioning about the responsibilities, accountabilities that Diana has been, assisting you with, but other than those things that you've mentioned, are there any other tasks that she's been doing? And how does she support your overall operations?
So she's primarily responsible for, scheduling. It's a shared responsibility, with our other employees and whatnot. Then also, primarily answering the phone calls and kind of, dictating what's important, what needs to reach, the physician aspect of things. And then we as physicians, will, ask Dana, hey, can you please reach back to the patient, with our X, Y, and Z response. And, the other biggest thing that I think she helped with was, and that was without asking, so I was very pleased with that. She was able to digitize our scheduling process where our previous office staff, you know, used to kind of, write things down. For example, right? I saw a patient today and I said, hey, I want to see the patient in a four month window. So they would kind of write it on an index card based on the month that would fall in. And then later on reference the index card, which, is not, ideal. So she was able to just kind of, digitize the whole process and, Google worksheets and whatnot. So now, right? Anybody with access to the internet can kind of see, who needs to be scheduled and whatnot versus, having to do it the old way, which was tedious.
Right, I agree. So the efficiency has definitely improved. That's
Yeah.
just so nice to hear, doctor, especially now we have AI, the technology, right? So I'm glad she was really able to have that integrated to your practice. So I'm so glad to hear this, Dr. Given, for sharing that. So now we'd like to get your thoughts on this. How would you address these providers or potential new clients that are really on the fence about hiring a VA?
I think having a virtual VA is a, big help. And, if I'm being honest, right? Why did I seek this? So I seeked it because of cost. Okay. And that, I'd be lying to you if I said cost wasn't the primary, factor per se. And, when I did this last year, there were obviously some virtual companies, that came up. It's not like I knew about DocVA from before, right? It was just, searching, via Google and whatnot. And I think since last year now, at least, maybe it's the social media algorithm, a lot of ads for various different VA companies now pop up on my social media without asking. So I think the whole virtual VA field overall probably has taken off significantly from, last year into, into today. But I would not hesitate for any, physician, especially, private practice who's kind of struggling to make ends meet. One is, obviously, there is, help with, cost because, the cost of providing medical care in the US has gone up quite significantly, especially in the field of nephrology, and reimbursement has not kept up at all. So, we're, as physicians, we're having to do, a lot more with, a lot less. So, having a virtual VA and, having reduced our cost is, it's a huge plus and a huge benefit. And you know what? People, the whole notion that somebody outside of the States might not be qualified, you can get stuck with, it's a leap of faith. Okay. So I was very lucky to, have Diana and I have Doc VA help kind of vet out the whole process to kind of make the process very, very easy. But I don't I think it's a good leap of faith for anybody to, essentially take because, at least my feeling is, at least with Doc VA, everybody is, vetted adequately. And I've been fortunate enough, like I said, to have Diana and, you got, the other thing I would look into a company is, right? It's one thing to provide an employee, then it's a whole, you guys also to a certain extent help manage, right? Every week I'm getting, emails from you, hey, how is she doing, right? To to the point, yeah, and you notice, right? My answer is roughly the same each time, right? She's doing great, but that's helpful to have that, okay, you know what? The company stands by, their employees, behind the scenes as well, versus, hey, you know what? I have an employee and then, what, I'm kind of stuck troubleshooting if things are not working out with that said employee and whatnot. So I think as a company, my experience has been, very well with, DocVA, and, my partner, Dr. Kwan, he feels exactly the same way as well.
Wow, thank you so much for that, Dr. Goodman. I was like about to ask you, why would you recommend DocVA to your
Yeah.
colleagues and peers? You already answered that, doctor. So, is there anything else that you would like to share before we end our conversation today?
The other thing, I would say that's positive for Doc VA would be is the cost to me compared to having somebody, who's US based, office based employee obviously is, going to be significant versus having a virtual VA. And, I also want to, treat, again, right, Diana the same way as I treat, my other employees, right? So, we usually give bonuses towards the end of the year, right? Holidays and whatnot. So there's always that concern, hey, you know what? Somebody who's far away, if I plan to give them a bonus, is that bonus really going to go to that person, or is the company going to take a certain percentage of it? And Doc VA did not do that. So I was very, very happy that, again, right, strength, towards the company. And, I think from what Diana has also told me, right, WA, takes care of, their employees. There's certain benefits, you're able to provide, such as, some stipends for health insurance and whatnot, right? So, I would sit there and say, there's definitely, positive points for WA. And, what anybody who's, on the fence, I would certainly, engage WA to, see what they have to offer, how they can help their practice.
Wow, thank you so much for that. I didn't expect that that Deanna was sharing those things to you as well about dog faces. Thank you. And you've been really taking care of our virtual assistant. So we really, really appreciate everything that you have, provided to Diana, and of course to your support with DocVA. So thank you so much, Doctor, for your time today. And yeah, you'll be expecting another message from us again this week, just checking out on your meeting.
Sounds good. Thank you.
All right, thank you. Have a wonderful day. You take care, Doctor.
You too. Take care.
Okay,
Bye.
bye bye.